For Tinels Sign, patient is positioned with their fingertips extended, wrist in neutral, so you have good access to the palm and the wrist. And then what you do is you simply tap along the pathway of the median nerve. As you might remember, hopefully remember from anatomy, median nerve is pretty much straight down midline between the thenar and hypothenar eminences and goes right down like that. So that's where you're going to be tapping. With Tinels Sign, typically you start tapping distally and then move proximally. It's not as critical when you're doing Tinels Sign for carpal tunnel syndrome, but that's typically how it's done anytime you're testing nerve regeneration, so we'll do it that way. It works really well with a reflex hammer, and so I would just start about mid-palm, where that median nerve branches out into the various digital nerves, and then work my way back. And you're just going to whack it fairly firmly, go right up along that pathway until you reach about the proximal wrist crease. Did you feel anything with that?
Nope.
Okay. So that would be a negative test for carpal tunnel syndrome. A positive test would be if the patient reported a zinging or a tingling sensation into those median nerve innervated fingertips, being the thumb, index, middle, and the radial half of the ring finger. If they described a zinging sensation or electrical shocking sensation moving into those fingertips, that would be a positive test. Tinels Sign can also be done if you don't have a reflex hammer. It can be done simply with your fingertip. And typically it's done with one fingertip kind of twisted over another, and then use your kind of reinforced middle fingertip then to do the same sort of thing, same tapping. All right. I think it works a little bit better with a reflex hammer than with a fingertip. Pain where you're tapping, that is pain in the wrist where you're tapping or whacking it with the reflex hammer, is not a positive test. Say if pain where the tapping occurs, that's something else. It's not a positive test for carpal tunnel syndrome. By the way, if they do have a positive Tinels Sign, that indicates fairly advanced carpal tunnel syndrome, because Tinels Sign is only positive when you have axons which have died away, undergone Wallerian degeneration, and are now regenerating. All right? So you'll only have Tinels Sign in fairly advanced carpal tunnel syndrome. So if you have a negative Tinels Sign, but you still think it looks like carpal tunnel syndrome based on your other tests like Phelan, Sturkins, and the history, don't worry that much about the negative Tinels Sign. But if it is positive, it's a pretty sure bet that they have carpal tunnel syndrome and that it's somewhat advanced.